if you don't have your systems updated by July 1st, what we encourage you to do is to save your intake forms and then to just upload the data from your intake forms into your systems by October 31st. So that is a firm reporting deadline. The other thing that I want to mention is we did approach ACL, as did several other states, about possibly extending the implementation deadline further. And ACL, at least back in February, gave us a firm no. So that's where we're at. So we definitely do need to have these changes implemented. Okay, I think that is the last slide that I had planned to address. The other thing that I just want to mention is Ellen and our team, we'll continue to work with you, provide tools. This is the first technical assistance call that we're having on the Oaps changes. We're happy to host further calls, work with you one-on-one to talk about your changes, your barriers, challenges. So we intend to continue to provide information, FAQs, tools, as you need them. Okay, I guess, Ellen, I'm handing it back to you.
Okay. So next slide, please. So I am just going to fairly briefly cover the changes themselves, which also were included as an attachment in the program memo that we sent out recently. So one significant change is that in the field of race, they will no longer allow a multi-select. Well, this will become a multi-select. So basically, for all registered services, you can no longer enter multiple race or other. Instead, you can enter more than one race for registered services. So next slide, please. I won't read all of these. I think probably most of you are familiar with which are registered and non-registered. But here is the list. And we'll make this slideshow available, of course. So these are the services for which you would need to update intake forms or screens related to the change in noting race. Next slide, please. Nutrition risk. This is already something that you report. They've just decided to clarify. So moving forward, a nutrition risk score of 6 and above will be a yes. 5 and below will be a no. Okay, next slide. Health promotion under Title 3D. It has simply been changed to, it's now health promotion evidence-based. The service itself has not changed. It's just the title. Okay, next slide. Title 3E, caregivers of older adults. This was previously called caregivers serving elderly individuals. So now it's called caregivers of older adults. And 2 relationships have been added, brother and sister. Okay, next slide, please. This is another title change. So again, Title 3E, what was previously grandparents and other elderly caregivers serving children is now simply called older elderly relative. And they've added 1 option, and that's parents. Okay, next slide. As you probably know, the AAAs fill out an annual staffing report, and you list your number of volunteers. So ACL has changed this from you reporting total FTEs and total minority FTEs to now they just want the total number of volunteers and the total number of volunteer hours that's in your annual report. Okay, next slide. Under provider data collection, you'll now need to report if a provider is a senior center or a focal point. Next slide. The Aruka Codes, this involves determining who is in a rural area. These should be used, okay, so Aruka Code should now be used to determine rural designation. It's based on zip code. And as you can see, RTZ Systems, which is the contractor that CDA works with to report the information to CDL, and that all of you report to the system that they run for us, CARS. So they will update this lookup to happen automatically for AAAs that use GetCare as their data system. And for the others, the specifications won't change. So, next slide. Probably the biggest change is in reporting legal assistance information. So, and this is under Title 3B. And formerly, legal assistance was a non-registered service. This meant that ACL didn't collect detailed demographic information for the services. ACL has changed it to something called a restricted service. It's like being a registered service, but you don't report the names, obviously, because of confidentiality reasons. So demographic information for each case is now going to be reported to ACL. It will be reported in an aggregate format when it actually goes to ACL. So again, names will not be used. Right now, legal services providers provide CDA actually quite a bit of information. We've been collecting this data quarterly for a long time. So it's not going to be necessarily more information, but we're going to need it for each case, and we're going to need it submitted electronically. So I know that that can be a hurdle, and we are looking at options to enable the legal services providers to do this, so or to assist with this. All intake screens and forms for legal services providers should be updated by July 1st. The data, the first reporting, the first quarter, will not be due until October 31st. So, like I said, we are exploring some solutions to help get that information into the CARS system. Next slide. So here is the data that is now required for each case and that we have to report to ACL. And I won't read this whole thing, you can see it, but probably the most critical point here is that we're going to need a client unique ID instead of a name and a case unique ID for each case. We're going to send out more detailed guidance for legal services providers and AAAs regarding, for instance, how to create a client unique ID, how to create a case unique ID. We know there are AAAs that have more than one legal services provider, and so we'll want to make sure that within each AAA that each legal services provider would have to have its own unique ID so that we would not, no case would have the same number, let's say from two different legal services providers. And we will, like I say, provide further guidance on this. Next slide. Okay, so we are, those are the changes, and we are happy. We have plenty of time here to entertain any questions. We're also putting together a frequently asked questions, document, which we'll be sharing very soon. We're updating some of our sample intake forms just in order to provide other assistance, and we're happy to consult one-on-one also. But for now, if you have a question, please raise your hand and we will unmute you and respond to your question. Let me see. I think I see some hands. So
we've got the first person unmuted.
Okay. Who's that? What's the name so they'll know?
Maiti.
I
apologize. Yes.
Yes. So you were saying that you were going to update the intake forms, the samples that you have. The one that currently is available for legal services, is that one going to be updated? Because there is one already on your website, but it is a PDF file.
Are you talking, you're probably talking about it's called CDA 1022. It's the form that's submitted quarterly. Is that the form?
No, there is an intake form. I think it's 1023 or 1021. It's similar to, it's a number very close to it, but it is for legal services.
Okay. Yes, we are updating any relevant intake form. And they're just, as everybody probably know, they're just sample intake forms that we provide in case they help. So,
Right,
so the
right.
answer.
Yeah. Okay, perfect. Thank you.
Okay, Kemba, are you able to unmute yourself? Hi. We're not hearing you if you're speaking currently. Kemba.
I'm sorry, I had the phone muted as well. Sorry, I was just wondering, what were the, thank you, what were the intakes that needed to be, or programs that were going to go through the changes again? I know you mentioned legal aid. I just wanted to know what were the other ones again. I wasn't able to capture it on this slide.
That's okay. It's a number of the Title III, and actually it's also in the program memo, but we will
Okay.
provide, make sure you have all of that information. So
Okay.
in terms of the intake forms, we'll send everything out, or probably also post it.
Okay, thank you.
Okay, next up is Gary Sutter.
Hi, we're currently using WellSky to capture our data, and I was wondering if plans have already been made with them to update their intake forms and so on for the reporting that's going to be required, including the legal stuff.
CDA has not worked directly with any of the data providers that you work with. There are a number of different ones in the state.
So as a follow-up, are you indicating then that it's up to each individual AAA to work with our, in our case, WellSky, to include those new criteria, whether it be the caregiver or the other requirements, like the nutrition? Well, I don't know if the nutrition thing's a requirement. I mean, we already entered that in there, but anyway.
I'm gonna let Elena with RTZ maybe address that question, because that's more on the technical end.
Sure. Yeah, we're not sure who everybody's provider is as a vendor. So the specifications, I believe, were sent out. And if there's follow-up questions about the specifications, those can be directed to us, and how to modify the data to be sure that it passes the validations.
Yeah, and this is Mark Beckley. We certainly do know the providers working the state, and we could send these technical requirements over to the providers. You would have to work with providers individually on the timing of the changes, since you have local contracts and the systems are customized a little bit differently for each one of your AAAs. So yeah, I mean, we could definitely do that, get the specifications over with to them, but you'll have to work with them in terms of modifying your local systems.
Will we be, I'm sorry, just to follow up, another follow-up question. Will we be given a specific contact information for RTZ, or is it through our current systems of Get Care Help, or whatever it is that we are currently using to work with RTZ? Or I'm just a little concerned based on the timeline that we're given.
I'm happy to connect you with RTZ. Yes, so yeah, we can connect you directly to RTZ for technical questions. Absolutely.
And for our RTZ partners, do you have any email address or specific contact information you want the AAAs to use, or would you prefer them go through us and then refer them to you?
Yeah, thank you. Yeah, they can go directly to us, and please be sure to include CDA in the conversation. So our help email is the same, carshelp@getcare.com, that's used on normal requests and changes for file upload manager and the fiscal tool.
Okay, great.
Okay. Looks like Dina. their hand raised up?
Yes. Is there any particular funding that we can use for this? Because last time we had to change to add the SOGI questions, it cost us a lot of money and we haven't budgeted for this. So what funding can we use to make these changes?
Yeah, we'll take that question back at CDA. I think that, you know, we can look how these changes might be funded, either through the state or through, you know, other funding sources that have become available. So we'll take that back. But if you could let us know what the estimated system change costs that you're looking at. I hate to do this to you, Ellen, but since you're the key contact in this one, if you could send those to Ellen Goodwin in the meantime, we'll get over to our fiscal staff then.
Okay, Yasmin. Thank you, Dina. Yasmin?
Hi, this is Yasmin. If I read the senior legal requirements correctly, you're wanting an individual case number for each client?
Correct.
So if they, let's just say they did a trust, a power of attorney, and consulted about some contracts. That's 3 individual case numbers or just one for that person because it was all at the same time?
I think that it's one, and that is a good question. I will confirm that. I think it's supposed to be the dominant, whatever took the most time, but I will check on that and include that information. I'll provide that. Okay.
Okay, and then does each service require time spent? So like in that example, would you have to put, you know, an hour to a will and trust or another hour to
Right. Those are really good questions. I will clarify that and send it out to everybody.
Okay, thank you. Because that'll make a difference how we set things up.
Of course. Okay.
So nothing cumulative is sent in anymore. That's correct.
Nothing. What? I'm sorry.
All right. Thank you.
Yes, that's correct. Nothing cumulative is sent. It's now individual case details. Yeah, I think I heard that right. Andrew, your hand raised.
Hi. For PSA 8, we're utilizing Q as our main source of data entry. And so I just wanted to clarify the specifications that we need to provide to our vendor in order to update our database. You're referring to the attachment B car specifications. Is that what you're referring to?
Correct.
Okay, thank you.
Monica, hand raised. Monica, you should be able to unmute yourself if you're.
Sorry about that.
That's okay.
Thought I was unmuted already. My question is regarding when you say legal assistance, is that only Title 3B legal assistance, or do those changes also affect the caregiver legal assistance?
When I'm talking about, we're talking about legal assistance, that is Title 3B legal assistance.
Okay.
Elaine? Thank you, Monica.
Thank you. This is Elaine Clark. Just so I want to clarify, we use Get Care. So all of these changes will automatically be put into the RTZ Get Care system. So we don't have to worry about that. And we will be receiving sample updated intake forms from CDA within the next how many weeks?
I think Ellen, go ahead.
Yeah, looks like Ellen. Oh, are you still on, Ellen?
Her internet got
Looks
weak.
like her internet might have gone off. I'm going to say that within the next 2 weeks, you should definitely be receiving the updated forms, but we'd like to get them to you sooner. So hopefully as soon as next week.
Okay, and then Get Care will automatically be updated, so we don't have to worry about that piece of it if we use Get Care.
That's correct. Our contract covers transitions that happen at OAA. Excellent. Kim.
Hello.
Hi.
I need to find out, you said to send information through the CARS portal for the legal assistance and keep a separate document. How are we going to upload that without having any errors and get sent back to us? Because it has to be a text file. It has to be, a certain way for you guys to get it.
Yeah, the file upload specifications, instead of being 5 files, is now 7. And the legal assistance data lives independently of the other 5 files. And their validations are internal to themselves, not to the others. So because it's a restricted service without client names, the client pool is independent of your other client pool.
Okay.
So there's guidance on that, yeah.
And those documents will be where?
I believe somebody mentioned the file name that was posted, but I don't have the exact name. If
Okay.
Ellen is back, she can probably speak to the exact file name. But the specifications were updated most recently as of April, so we can share that too, and take a look at those.
Yeah,
Okay,
and any questions that we can't answer on this call, we'll definitely follow up in the FAQ.
Jamie? You're speaking, we're not hearing you yet. Looks like you're unmuted. Jimmy, we'll go ahead and we still can't hear you. We'll go ahead and ask the next person, and then hopefully your audio will be updated by then. Glenda?
Hi, this is Glenda, PSA 7. I saw a comment in the chat from RTZ that the slides will be sent to the same participants that received the invite to this meeting, and I'd like to request that we actually send it directly to the people who are attending so that we can get this information in a more timely fashion.
I believe Ellen sent out the invite. I'm not sure if we can grab your email address, but if you're concerned about it, please go ahead and add your email address into the chat, and we'll copy the email addresses out of the chat and provide that back to CDA so they can be included.
Thank you.
A quick question from the chat. I'm trying to manage both, so I apologize if I've skipped something through the chat. Will decline to state still be an option for various fields, including race? Yes, decline to state is still included. Just remember that decline to state is a value that technically in the federal world counts as missing, but within the state, it's a distinct separate count. Gary?
Thanks. I just wanted to get clarification on legal assistance. So in the program memo, I think you mentioned it here that CDA was going to be working with a provider so that with someone so that the providers can input them directly, but are we required to have this done again, in our case, through WellSky until that time happens? Or what's, because it says we have to enter it in by October 31.
Looks like it's.
Yeah, so I can speak to that. Yeah, the intent was, given such a short time to update your local systems and collect data, we have been exploring possibly standing up a separate database that your providers can enter directly into, and then it would automatically upload into CARS. So it would, you know, mitigate you possibly having to update your system for these changes. Again, we don't know whether or not that's possible, so we're spending the next week to explore that, and then you know, we can give you a definitive answer for those you know, AAAs that are currently on RTZ. The system's already updated, so nothing for you to do there. But for the other providers, you know, that could be an issue. So we're exploring it. I can't commit to anything at this point. If it is possible, we'll definitely put a system in place and notify you. So yeah, we're hoping to get that answer fairly quickly.
And just a follow-up, so what, I'm just wondering how soon we would need to engage our, if it's up to us to start the process in the event that you guys aren't able to secure another system, and if it's up to us to engage our current database people, which again is for us is WellSky, when will we know when we have to do that or not? Should we start now? Or?
Yeah, I would, you know, I would start now just to you know, put your providers on notice and let them know that they may need to react quickly to put these changes in. Again, the data needs to be starting to be collected by July 1st, so it's not required to be entered until the federal date of, you know, required date of October 30th. So, you know, if we can't put a solution in place and you are required to change your systems, you know, it will be possible for your local providers to hold on to the data, but it will be kind of like double entry work, right? Entering it into, like, you know, the intake form and then entering it again into the database. But like I say, we should know within a week. In the meantime, I definitely contact them, give them a heads up, and we'll let you know one way or the other by the end of next week if this is something we can do.
And lastly, the Form 1022 requires a lot more information than what was listed in the attachment A, under the legal portion of attachment A. Is attachment A the only thing that is going to be required through the electronic, this new system, or is it all the other additional information that was also included on the 1022 form?
Right. So the 1022 form's being discontinued, so it's just the information in attachment A that'll be required to be captured.
I'm sorry, I missed what I didn't quite understand what you said. So are you saying that the only the stuff on attachment A is now required?
Yes, stuff on attachment A is the information that's required. I'll double check that, you know, with Ellen, but that's my understanding.
Can I ask a question? So
yeah,
wouldn't it be easier, because so we, PSA1, we also use WellSky. Wouldn't it be easier for like a single person to reach out to WellSky, and I'm sure there's some other ones that rather than 12 different PSAs all calling WellSky and asking them to add the same stuff?
Yeah, and that's what I said at the top of the call, that, you know, CDA will reach out to the current providers and give them all the technical specifications. If we can coordinate that at the state level. I mean, the only problem there is, you know, we don't have a contractual arrangement with these providers, but if they are kind of willing to do this in a more coordinated fashion on behalf of all the AAAs, we're more than happy to do that. So sure, yeah, we'll do the initial reach out, and then we'll ask them if they need to hear from you directly, since each of you, hold separate contracts with them. But if there's something that they could do centrally, and then of course we'll explore, funding and costs as well. But yeah, so we'll explore that.
Great, thank you. And when should we expect, so if you guys are going to reach out to them initially, should we just wait to hear from you before we start that conversation?
Yeah, you can wait to hear from us. We will reach out to them we have contact information for all the existing providers. So we will reach out to them either end of today or first thing tomorrow. And then we'll ask them, if they could coordinate this centrally on their end, or if they need to hear from you individually. And then we can send out an email to follow up and let you know what their answers are.
Great, thank you.
Going back to the hands raised, Jamie, is your audio?
Can you hear me now?
Yeah, thanks.
Oh, good. My question's similar. We use legal server, which is becoming quite popular as case and client management system. So the same question kind of applies, which is, would you be able or willing to talk to legal server about enabling these fields, or possibly, if that's not possible, then we could possibly coordinate with other users of legal server, since it's becoming quite popular, so we don't all end up duplicating the same work to customize our databases.
Yeah, we could certainly reach out to them. The only issue I could potentially see with getting another party involved is how quickly they could stand up the changes, and if there's a need for a separate purchase order or contract for them, how much time that would take. So we do get concerned about timing. So when we talk about possibly standing up a database, this would be, sort of a CDA developed database that we could control the timing over and quickly deploy. But at this point, we're willing to explore several options. At the same time, we also want to be mindful of the timeline. So that's why we need to get an answer for you if we have another alternative or option out there for you, or we don't, in which case you'll have to use your existing systems.
Okay.
Ron. Andrew?
Hi, thank you. Yeah, I'm new to the AAA and still trying to get wrapped around all the reporting in general. So could you please repeat the memo that has this information on it for future review?
Yeah, and I would be happy to upload it into the chat. I don't have it in front of me. And I apologize. Ellen is so off. She's the one who's back.
Mark, I'm back. I just got back.
Oh, good.
Yeah.
Oh, good. Thank you, Ellen.
Yeah.
Yeah,
I have been on the phone, but yeah, we can provide that. We'll make sure everybody has the link to that program memo that has all the information. I can actually look for that right now.
There it is. Yeah, PM
Great.
21.
Yeah. Thank you very much.
So much, yeah.
Nang.
Clarification on the definition of AAA volunteers. Do we include like ACOA members, high cap volunteers? Could you provide a little bit more clarification?
My understanding is that the definition of a volunteer hasn't changed from the current NAPIS report to the new Oaps report. That the change that's happening is that they're no longer asking for a distinction between total full-time employees and minority employees, and that they're now asking for hours volunteered, which I think is the interesting part to have to collect and be sure you have a way to track that. So it's just a heads up that you'll have to report out on the number of hours that your volunteers donated.
So is that just volunteers who volunteer directly, like in like the AAA administration? Like it doesn't include like Meals on Wheels drivers and other volunteers. Is that correct?
I believe so. It's the current definition. So however ACL currently defines that would still be true. So however many volunteers you would currently report in last year and this year would be the same amount. It's just how many hours did they also volunteer?
Okay, thank you.
But I think that's the last of the hands raised. There was a few leftover hands raised, so I didn't want to call back on you if you didn't have another question. But if you do, please go ahead and raise your hand again. I think there's a handful of questions through the chat. I'm going to see if I can go back and review back through those. This is from Robin. Our organization, I apologize, the chat jumps when something's added. So let me see if I can stay still. Our organization is not connected to WellSky or CARS. We send our intakes directly to AAA. Are we going to be required to be connected to do this directly? I believe the answer is no. If you're currently not sending data, I'm sorry, I have a clarification question, Robin. Are you speaking specifically about legal assistance or any other kinds of services that are AAA services? I think the distinction matters in being able to answer sufficiently. Robin says any AAA services. So the way you're currently reporting AAA services and other Title III data is going to stay the same. So whatever system you're currently using to collect that data, you would continue to do that. And if you're uploading the 5 files to CARS on a quarterly basis through File Upload Manager, you would still do that as well. So that part of the aspect hasn't changed yet. Thanks. There's a question if this is being recorded. Yes, I did start recording it. I missed the first, I think, 2 slides, or the introductions at least, but it is recorded. So if you want to send that out, it can be distributed. I think I've gotten to every question. I'm trying to get back up to the very top. So if your question hasn't been answered, please raise your hand or add it into the chat. And I apologize if I missed it through the chat. Trying to read back through.
Hi, I have a quick question. I just want to make sure we get the RTC email if we have any questions.
Sure. Our help email address is CARS, C-A-R-S, help, H-E-L-P, @getcare.com. And if you're currently uploading data to CARS and have access to log into CARS, our help email is posted there. And the normal contact, if you have any questions or concerns about their file upload, would be the same email address. Just please be sure to include CDA in that message. Will said there appears to be 10 different Aruka codes. I'm just curious which ones count as geographically isolated areas per the interstate funding formula. There's on the ACL website, there is a Aruka code sheet. I can hop over there really quick, I think. One moment.
This is Monica again. I'm sorry. I'm in Imperial County, and I guess all of my cities are considered rural. So I used to have that question at what I would ask my recipients, but I guess we're all rural based on Aruka codes.
Then that's an easy transition. So you just default your answers to be rural instead of having. So this is the ACL Oaps pilot site. This is where all of their documentation lives for their resources. Inside of the Title III section, there's a Aruka code sheet in here somewhere. There we go. So in here is the rural urban commuting area Aruka codes, and on their link, if you click on this link, it jumps you to that website. And within this website, it defines what the Aruka codes are. It goes on into great length. And then there's a file down here that's the most recent updated in 2020. And it gives you a code on which Aruka codes are rural, urban, or frontier. And it's by state as well. There's a question from Amy, what programs require revisions to intakes aside from legal? The biggest changes for all other services is the change on race being multi-select and removing the options multiple as a selection and other as a selection. The current race categories are going to stay exactly the same. They're more defined in California than they are at the federal level. But the ability to select for more than one is what ACL is really moving towards. And then they that count is a duplicated count, and then they deduplicate a minority count after that. I don't see any other new hands raised. Ron, did you have another question, or was your hand just raised?
No, let me unraise. Thank you.
Sure, thanks. I think that's all of the questions. I see Jay Leonard.
Yeah, and this just has to do with the race thing again. You say if they're taking away the other option, what do you do if the person is a race that is not listed then, or races?
I think from ACL's perspective, it's missing. I think they've narrowed their scope. So to them, it's considered missing.
So that's the same as did not answer?
Correct. Yes. Yeah.
That's kind of not accurate though, because they do answer, and it's just based on the state's selection of races to put in is what's inhibiting them to put in their race.
Yeah, I agree. Federally speaking, they've defined a list of choices. Whether or not that's a good list or not, I agree with you.
I have an issue. I'm sorry if I can take a moment. In my system, when people consider themselves Hispanic, and for me to put that, it just says white Hispanic. And Hispanics can be of different races, not just white. So that's hopefully with this new fix, I'm going to talk to WellSky to see if we can fix that issue. Because we have Black Hispanics, we have people that are of Native descent that they consider self-Native Hispanic, white Hispanic. So there's so many possibilities there, and yet we are, if they answer yes on Hispanic, then they're automatically right.
Yeah, and as far as ACL Oaps is concerned, the ethnicity as a choice is independent of race. So you can answer ethnicity as Hispanic or Latino, or not Hispanic or Latino, or it's missing. So it is an independent choice, and race is an independent selection as well. Got a question in the chat. Does the calculation for hours for senior legal assistants include the time of all staff involved or only the time the attorney spends with the client? Does this include creating documents and other support type work? My initial, go ahead.
Can you hear me?
Yes.
Oh, you can. Okay, great.
Yeah.
I actually don't know the answer, but we will clarify that. We're going to provide, I know there've been some other questions related to legal assistance, and we will clarify the exact details and requirements for reporting.
Thank you, Ellen. Will client data be masked before it gets to AAA level? What about attorney-client confidentiality? And the data that you're sending would not have any client identifying information in it other than date of birth and rule designation. So if I go back to this slide, you're not providing for aggregate reporting level, the data that gets sent as individual case and client information is rolled up to display and file upload manager aggregately. So ACL would not receive individual details, and file upload manager would only present the summary counts for these things. Patty says, but I can see it at the AAA level now for all clients. If you're already collecting more detailed information than what's being requested, then that should be fine. You don't have to send the individual detail that's unique to the client. You'd only have to send the de-identified information. Okay, we've got about 4 minutes left. I don't see any new questions or anything. If I've missed anybody, I'll see if I can go back really quick and see if I missed anything, but I think we're caught up.
Okay.
What I'll do is I'll kind of give a rundown, at least in terms of some of the key takeaways for CDA. The first is we have committed to getting the information, the specifications over to the existing, your existing contractors. So we'll do that. We can reach out to WellSky and the other providers and make them aware of the changes. We also will have a conversation with them about whether these changes can be coordinated centrally through CDA, and then they can do changes to your local systems, or whether they need to speak with all of you individually. So after we have a chance to speak to the providers and get that information, we'll email all of you to let you know, what we can do. The other issue was with funding. And I think I'm going to take a slightly different approach. Rather than sending emails individually to Ellen, I think what we'll do is I'll have our budget section put together maybe a survey or a request to see what the vendor cost would be. And again, if we can speak to the vendors and get that cost captured centrally, we'll do that as opposed to each of you having to talk to individual vendors. There's also a question about the legal services data being different than what we capture on the 1022 and actually less than what's on the 1022. So I'll confirm with our program staff. I believe the answer is you only need to capture the information that's in attachment A, not all the information we previously requested on the 1022. But again, we'll get confirmation on that. And then the final key item I'm tracking is whether we can, and again, maybe what we'll do is we'll talk to each of the providers first, see if they can make the changes to their systems fairly easily and meet the July 1st deadline, or if it will be problematic. If it's problematic, we'll continue to explore doing a CDA-driven solution, or possibly work with the legal server provider to see if they could present a solution where the providers can just enter the data directly into a database that can then be uploaded into CARS. So we can take those. So hopefully we'll get information to you either by the end of this week or early next week to those key questions. But in the meantime, feel free to email Ellen with any additional questions you might have after this call. And we can send out a fact sheet to answer any additional questions you have.
Thank you, Mark.
Okay, well, with that, I think we could probably wrap up the call. Is there anything I'm missing, Ellen? Anything else we need to mention before we sign off?
I don't think so.
Okay. Okay. Well, thanks everybody for your time, and be on the lookout for an email from us.
Thank you.
Thank you, everyone.
Thank you.
Thank you.